A dentist from Rapha Dental Services, and today we are going to be discussing all things oral health. If you do not know, a few things are not, because Edwin here is going to give us more information about oral health awareness. Good morning, you're welcome to the show.
How are you doing?
I am well.
Our viewers out there, good morning to you. We are yet to have this very important show. Or a nice talk of oral health awareness. This is something that we focus on in oral health promotion. Maybe to introduce myself again now. Taremwa Edwin, dentist at Rapha Dental Services.
Dental Services, yes.
Yeah, but here we are to share something very important, briefly. We shall not dwell in too much details, but we shall be brief on point. So that our viewers there for Family TV can really pick something today.
Of course, oral health is something that is very, very important.
Very important. But now what I wanted us majorly to focus on, I wanted us, before we even know the importance of oral health awareness, let's first know, do we really know what oral health is? Because it has been always like this. When someone says oral health, someone just depicts it on the teeth. Teeth, that's what people know about oral health. But that's literally not what we really want to focus on, because we have seen problems in the oral cavity arising out of, maybe some have the odontogenic origin, like from teeth, but now we find others are having other origins from the oral cavity. To say, like, if you can just briefly define it, you can call it maybe general well-being of the oral cavity, and of which our viewers out there, you find the oral cavity is having different things.
Before you go any further, what is oral cavity? We need
oral cavity. That's what I'm going to, because I would have made a big mistake not introduce that. And now when you talk about the oral cavity, we are meaning basically whatever is entailed in the mouth. If you can, in the layman's language, in the mouth. That's why if you'll find teeth, obviously, that's what most of us know. You find teeth, you have your tongue, you have your gum, the palate, that's the soft and hard palate, then the oral mucus, this soft thing you feel smooth enough. So when you find anything deviating from the normal feature, but then to know something that deviates from the normal features, you must know what are the normal features before knowing the deviations. So our viewers out there today, before knowing how it is important to know about our oral cavity or our oral health in health promotion, at least I would like to spare some minute. We go through how our normal oral cavity or normal mouth should look like.
Please do.
Because at least from there we can dwell our points, and at least we know that today we have delivered something out our viewers there for Family TV. So to start with, if you maybe talk about the teeth, people normally mistake them, because you find people are crying out there, they want white teeth. No, God created us in a unique way. You find maybe you're dark skinned, you're most likely to have slightly teeth which are a bit white. The shade, we're talking about the shades. Then you find the light skinned, they have slightly yellowish, light yellowish. Find the other shades, some are more yellow, but find people are focusing on making the teeth white.
Is that normal?
No, in fact, for us we call it breaching. Breaching is something deviating from what was normal, but you're trying to create something. Obviously, due to some reasons, I wouldn't recommend it, but it would not be the proper way. Just maintain the normal color of the teeth. If you find something deviating from that, then we are going astray. Then you find their teeth, where you find you have maybe holes. Tooth is not supposed to have a hole, if I can bring it broad like that. A normal structure of a tooth is not supposed to have a hole, unless there are those normal grooves of the posterior teeth used for chewing, so that they can capture the food you are eating, the masticatory process. Then we find, leaving alone the teeth, maybe we have talked about the color, that's where that's on entails, or maybe the stains, all those, maybe the hole, or another change in the color of the tooth. Then also the shape. We must know the normal shape of the teeth. Anything that deviates, maybe it's a fracture, that one we are deviating from the normal or physiological appearance of the teeth. Then you go to our tongue, maybe to be brief, our tongue, we talk about the oral mucosa, the soft palate, the hard palate. All those are not supposed to have maybe wounds, if I may say. Any wound found on those areas, just know you are not dealing with a normal thing. Quickly run to a dentist. Most people tend to just say maybe it will go. Yes, however, sometimes
take antibiotics.
And that's self-medication, but then you really find that it's always maybe if it's poorly treated, because some have a tendency of going by themselves, like the self-healing. Maybe those which are immune mediated, you find maybe if the immunity is boosted, then they eventually go. Then we find maybe the unique thing on the tongue. Find tongue also has maybe scratches. That's also something that you shouldn't call normal. Okay. Really, you find there are some deviations we must master. At least if you look at just get a mirror, even if it's just this phone of yours. Yes. Just look through, you say, is it really going on well? Then the very last thing is the gum. That's where we must find the problems. That is in maybe you find the gum is bleeding. Gum bleeding is the commonest thing, and you really find gum bleeding is most likely linked to poor oral health or poor oral hygiene. Reason being, there are some things which I don't know whether I've ever seen them. This is called cariculus and prick. Those things that get attached to the two surfaces. You find them maybe like dark, and the food keeps piling. That's why I'm telling you it's attributed to poor oral hygiene. If you fail to remove food, maybe for instance in the morning, because you normally advise all people to brush at least twice a day. In the morning after breakfast, not after waking up, and also at night. But if you fail to lie into that frequency, then you're obviously going to mess out. So I was thinking about how bleeding, in most cases, how it normally comes about. So someone is trying to remove those things using a mere toothbrush. They cannot come out. And as a mechanism to get them out, someone will use a lot of force. Get them out, because really they look bad. It may smile like this, and then someone says, cause out here. So someone tries counteract that, but little do we know about that it can be done professionally by dentists. You can do scanning and polishing, then we find we are taking them off. So that bleeding, it normally comes about due to those factors. We are trying to use excessive force, or even if there are not those cariculus or breaks we are talked about. Someone may use poor brushing techniques, which I think maybe we can organize some other time. We go through all those techniques as opposed to you say that you don't harm your gum, because bleeding gum means you have caused damage or trauma to the gum. You may use an old toothbrush, maybe it has bristles which are maybe worn out. I think that's it. But maybe we can now go back to our...
But before we go that, we have spoken about the tongue, the gum, and the teeth. Some people also have an issue of bad breath.
Bad breath.
How does that come about?
The bad breath, by the way, that one is, maybe you can call it halitosis, but it has different types. And of which some are psychological. There is halitosis where you find you feel it within yourself, but someone can't feel it. That's something that needs to be dealt with psychologically. Someone visit the dentist, you talk with that person, you share something. Then there is this one which is due to maybe attributed to poor oral hygiene. Obviously, it may not be poor as I talk, but it may be due to decay. Tooth decay. Anything that is decayed must smell. So tooth decay, or what we call dental caries, it obviously has to cause bad breath. Then also take a look of someone maybe doesn't brush. People, you might talk on TV, on radio, even when we meet people on outreaches, we tell them brush, but it just goes like that. People don't normally tend to comply to this thing of regular toothbrushing, so that you end up having a bad smell. That bad odor always comes like that, but most people find it, they are able to tell that I have a bad smell, but for you yet you cannot feel it. So that is mostly psychological. Or some people use some drugs, maybe these abusing maybe like marijuana. Obviously they have to produce some smell.
Definitely. Yeah, okay. Then also, let's talk about toothpaste. Can toothpaste affect your oral health?
Toothpaste has a very big influence. Reason being, what are we targeting in toothpaste? It is just fluoride. There is a content or a mineral called fluoride, which you are basically targeting. If you buy any toothpaste without that content,
without fluoride,
just know you are just wasting time.
Really?
Because what is fluoride doing? Fluoride is trying to mineralize or add minerals on the tooth. You know, often you find the tooth maybe is losing its minerals, maybe due to different factors. But now you are applying toothpaste with fluoride. That means it's one way of fluoridation. We normally call it fluoridation method of applying, or it is like a channel or a mean of applying that toothpaste, that fluoride content on the tooth so that we can remineralize them. When a tooth is remineralized, it gets strong, and then you find it's not, have you ever found, maybe I've never seen such people with fluorosis. There's what we call dental fluorosis, where you find the teeth are changing the color. As they have as if they are waves in the white spots, brownish. It means maybe there are circumstances where you find that fluorosis is also too much. That's why they tell you when you are applying that toothpaste, apply a small portion. They normally say T-shape. The toothbrush. Don't apply it cover the whole thing. Bristles.
Yes.
That's why you find you are applying too much fluoride, then the tooth will eventually become brittle. Something like maybe like this glass.
Very light. Can easily break. Yes.
That's why people, when someone is subjected, maybe it's small fracture, you may fall down and I fall down at the same time. Yours break, mine keep there.
Okay.
That means maybe the mineral content is either too much or it's not actually there. So it's always good. Actually, we normally, if you are looking to look into fluoride application, you're ideally not supposed to put that toothpaste on the brush. You're supposed to merely clean your teeth with a mere toothbrush, rinse it in water. Then later on, you get your clean finger, put the toothpaste, then you apply. After like 5 minutes, you rinse. That means that the toothpaste has really got into contact with the teeth. You get. However, it is not yet common. But why is it not common? There are some things, maybe this time we are remaining with. There are some things that we really, I can call it oral health seeking behavior. It is still low in most African countries, if you may say. Because you find people are putting this debate of dental is expensive. And they are using it as the major reason as why they are not complying to these programs. But why I want to say that it's not true. You find these campaigns that come in, maybe outreaches, Rotary has organized, maybe a medical camp, or people, such institutions. Now, for example, I hear there is something, dental conference in Mulago Dental School starting from 29th September up to 3rd October. When people are called for such free opportunities, they tend to go there. Those who tend to go there are those who are actually already sick. You see what I was talking about health-seeking behavior? That urge of someone saying, I think I should know about my oral health.
Yes.
That one, like it should come intrinsically within you. You feel it necessary to go and check. But you find the people, maybe such programs when they organize it, people who come, actually those who even, someone coming in a clinic touching here like this with a swollen jaw.
Yes.
You see that situation? That means pain is too much. And what has actually influenced that person to come is the pain. And you find, maybe if you to discuss about how you can go about that, you find they are not really complying the treatment available. Maybe if it's a root canal, it's a root canal treatment, you find they are not complying. They say, extract it. That's why they ended up calling us abakuzi b'amannyo. And that thing is, I think it's almost everywhere. People call dentists abakuzi b'amannyo. Yet our major focus in oral health promotion is maintaining the normal structure of the tooth. How do we maintain it? By really making sure, maybe if it needs cementing, if it needs root canal treatment, if it needs crowning, Like there are various things.
Yeah.
Even we got the deepest level of finding, even if you have lost it, to restore it.
Yeah.
It's something that is now modern. We are now in a modern world. There's dental technology.
Yeah.
People make teeth, they put them there.
Yes.
Someone is having a gap. You know, that's why maybe this one can bring us to the one of our major aims why you are here, the importance of oral health awareness.
Yes.
Oral health awareness, this one we assume someone is now aware about the oral health and maybe the normal and the abnormal oral health. If someone knows that maybe I don't have teeth,
yes,
that person will have that what I was calling the oral health seeking behavior to go to the dentist and maybe find out. And now the advantage comes in. Someone who had maybe missing teeth will go to the dentist or dental technologist. They make maybe permanent or temporary teeth, or maybe you can call them dentures. You have seen people with bridges.
Yeah.
That person, remember first of all the phonetics, like the speech. Someone has been affected by speech. Someone has not been smiling. There's the aesthetics, but you find after someone going to maybe getting aware about these programs or the oral health. Someone is able to do what? To smile again.
Yes.
Someone is able to associate socially with the colleagues. Maybe you find someone maybe is in a meeting, can't even raise up the hand to talk. Or he puts on a mask. You get that trauma. But then you find at the end of it all, having known much about our oral health, someone is really able to associate. That's one of the maybe the importance. You get.
Okay.
There are other associated things, maybe the cost. Someone reduces the costs because maybe if I may take a look of our viewers out there today, this morning, someone has known about that. Maybe I'm supposed to clean my teeth every after breakfast and when I'm going to sleep. That person will start practicing that thing of brushing twice a day, and then the tooth decay that would have come in due to poor oral hygiene, that money would be saved. Back to the other point of people saying dentists are expensive, that would be now what? The solution.
That's true.
Because you are now aware. Which reason would you give? Because they say dental is expensive, which I totally disagree with, but it is the cheapest. The dental conditions are the cheapest to prevent. Because now the things we have been talking about, toothpaste, at least you can get a toothpaste of 2,000. You can get a toothbrush of 1,000. Actually, we normally advise people to use soft bristled toothbrushes. I think those are the cheapest, 1,000. Nice. I won't put on market any company of toothbrush, but just focus on soft. Because there are many questions that normally come in. Doctor, which toothpaste can I use? They want to maybe target some company. You say, buy this. But my goal is, does it have fluoride? That's all.
But just hold on a minute on the toothpaste. There is some toothpaste I've come across that has no fluoride, but it has the natural elements, cloves, aloe vera. Is that okay? I
can call them supplements, but our target is fluoride, because research was made and it was that is the most important mineral or nutrient that can help our teeth. Others are just, have you ever traveled through these public means when we go to village, you find these people who are coming in. They have their toothbrushes, their toothpaste with no fluoride, but they tell you these help in whitening. These can clear away the holes in the teeth. Then you find people are buying 2,000, they are always cheap, 3,000, but they find you are deviating from what you're supposed to do. But then just because if someone is already sick, really the compliance becomes obvious. Someone finds it as a cheap option because he went to the dentist, maybe he was asked maybe something like 20,000, which he never had. But now here comes someone selling a toothpaste, which he says it can clear away the toothache. Obviously, someone will go with that.
Definitely.
So all those things talking about the aloe vera, yes, they may provide a nice and maybe good odor, but on what we are focusing on is the fluoride, mineralizing the tooth structure.
Now, just briefly, tell the viewers how they can maintain their oral health.
Maybe to come back, the best thing to maintain oral health is proper oral hygiene. How do we maintain proper oral hygiene? We have talked about brushing. people may keep asking themselves, why is the dentist telling us about brushing twice and emphasizing on before breakfast? I mean after breakfast, because people, how we grew up, if you have tried enough, you can after waking up immediately you brush, you go for work, breakfast finds you there, or you take it from home, then you again brush. If you are lucky enough, those are rare people, find they even brushing at night. But now why am I saying brush after breakfast and at night? You're right, maybe to bring it more clear, at night when you have brushed, it's on, maybe I can call it 100% that when, because we I said you just don't say at night, but before sleep, for bedtime, brush, go to your bed. What will you be eating in deep sleep?
Definitely.
It means you are going to wake up with a fresh mouth. That's why, that means you not find that urgent need of trying to brush early morning.
But then I'm going to work. Of course, I need to brush.
You know this. Okay, this one, because you have asked me, how can people maintain their oral health? Is it hard for you now? You're coming for work. Is your bag too small to carry toothbrush and toothpaste? At least now we have found it that at least every workplace there is a sink.
Some are not that clean.
Even if there are no sinks, at least isn't there a source of water? At least. Because what I'm focusing on, why you brush in the morning, you're trying to brush after breakfast, so that the entire day you spend it with a clean mouth. Then at lunchtime maybe you may rinse, hot water, rinse and spit. Because our aim in brushing teeth is removing that soft food debris that have stayed in the mouth, so that you can move as quickly to avoid the other things which I was saying, the calicula's, those things that get attached. Because the moment they delay there, that's when they will be there for a long time. Then you find acid forming in, coming acid burns, of course. That's how dental caries is coming, those holes. Then another thing maybe I can tell the viewers as we are concluding is the practice dental flossing. There is process, those small threads. They can put, those ones are just used to clean the interdental spaces. And maybe you have eaten fiber meals, maybe like meat, those mangoes, they have got stuck into the spaces between your teeth. Obviously, that's how best you can remove them. Maybe another thing is avoid applying excessive force, because the teeth, they were designed. Maybe I think God had biology, had physics, because for them they are designed to absorb a certain force. That's the masticatory force, force that is achieved from chewing. That's the maximum force they can achieve. But now you find someone is using the teeth that are supposed to achieve a maximum or threshold of the pressure from occlusion or wound from the force from occlusion, but someone is using it to open a bottle of soda.
Oh wow! Yeah, we actually do have such.
Very many. Don't just say some. There are very many. Because it is very easy. Because maybe you may find a situation where you find you have gone maybe in a party, maybe the opener is too far. It can also be a preventive measure. Always work with your. I think I have my opener. I can maybe show it to you.
On the key holder.
It must be there because this one will prevent me from opening the bottle of soda with teeth. Because now, as we are talking about, maybe you may find your tooth is, maybe they did a root canal on it, or maybe it has lots of minerals, and then it is too brittle, like any force, minus the force of maybe when you are chewing, any force can subject it to fracture. So the oral health is lost. Quite interesting. If you could kindly speak to our viewers, just briefly give them, I don't know, some form of awareness. The form of awareness I would maybe not leave out is to again emphasize our dear viewers to maybe try by all means at least to visit the dentist at least twice in a year. That can be at least enough for us to determine, because now you may not know your oral health status, but at least for us we can know, having checked. Because however much maybe use a mirror, but it will not depict what exactly, maybe if it's a small hole, if it's maybe the teeth are losing their strength. You know, some people come when their teeth are already mobile, maybe you can come on the 3rd degree mobility. find you cannot do anything. You cannot spring the teeth, you cannot do anything. At least what I can leave out with the viewers to always visit the dentist at least twice. That's after 6 months. Those are adults. But at least a child can come maybe 4 months. Visit the dentist just as you can frequently visit the dentist, I mean a doctor, for maybe checking blood pressure. It doesn't necessarily mean that you must first get the signs of high blood pressure or hypertension for diabetes, to go and test diabetes. Just find it just like any other body condition, because these are the conditions. I wonder why people say things are expensive, but find a kidney is part of our body. But someone can easily get that money to go to India to operate a kidney, but
you cannot go for a checkup.
Cannot go for a checkup. Even if it is just 10,000. Then maybe to conclude with is this campaign I was telling you about, the 29th of September at Malago Dental School. There is a annual dental conference, I've been told. And I really call upon all our dear viewers. Tell your colleagues maybe who have not been able to watch this program. How did they come? It will be a 1 week treatment, free treatment. Giving people free teeth, giving those services, cleaning, cementing, root canal treatment.
What dates
advice
will that be?
That will be a Monday to Thursday, 29th to 2nd. Then 3rd would be a dental conference. Maybe that one can also be another way of getting aware about our oral health. Maybe other programs that come in. Rotary has organized a medical camp. Certain politician has organized. For you, don't focus on what the politician is focusing on.
Focus on your dental health,
even
on your oral health.
Even if he's a noob, for you just focus on your what?
Oral
health. Otherwise, it has been really nice to interact with you, and this has been my 2nd time here, and I really think we can organize more programs. Because the goal is oral health promotion. That's what we are aiming at.
Thank you for coming here and of course giving us this information. There's some things that I did not know that I've gotten to know, and I know for our dear viewer out there, there's some things that you did not take seriously when it comes to oral health, but it is a sign for you to go for those checkups. At least go twice in a year to visit the dentist. Just go for a checkup, even for your full body checkup, just to make sure that you stay in good health. And of course, this has been a very insightful discussion on oral health awareness and its importance and how you can be able to maintain your oral health with Taremwa Edwin, a dentist from Rapha Dental Services. And of course, we have come to the end of the show, but thank you for staying tuned till this time. But do not go anywhere, because we are having issues at hand coming right up next. And of course, today is a Wednesday, meaning that we have the Uganda we want. So definitely you'd also want to look out for that. But for now, it's time for me to say goodbye, and I wish you a beautiful, wonderful day.